Hey, this is Dr. Jeff Ullery from Whole Body Health, and today with me I have my beautiful assistant Judy, as well as our therapy dog Isabel is joining into the picture. We're at the lake, and I figured we'd come out here and show you how to do some cupping. Judy tends to carry a lot of her tension up in her neck and shoulders. I hear that from a lot of patients, and so what we're going to do is just do some cupping up here in her shoulders, and I just want to show you kind of how to do that with her. This I've mentioned in the other cupping videos this is an ancient, this technique is around thousands of years, originated in Egypt and China. And so it's just a real simple way, if you have a set of cups at home, to actually get some relief in the neck and shoulders. And I've got a set of cups in each of my treatment rooms, but I also have a set of cups at home. So if I'm not around and somebody needs some work, or I need some work, I can have either my kids or Judy use the cups with me, and oftentimes if I'm not around, they'll use them on it with each other. And so I've shown them how to do that. So what we're going to do is we have different diameter of cups. As we move into the neck region, that's a nice little bird. We'll move into the smaller cups. As we get into the broader surfaces, we'll use the bigger cups. And so the first thing I like to do is just kind of poke around on the tissue and see what's tender and what's not. So that's a little bit tender right there, Judy. Mm-hmm. Okay. Here as well?
Yes.
Okay. And then on this side? Mm-hmm. All right. And then what about here in the neck?
A little bit.
A little bit tender there? Okay. So I'm just going to kind of keep it centralized and just work those areas that she said she was tender. So I'm going to start, like I said, with the bigger cups. And Judy gets a little more tender when we do the suction. And so I tend to not put as much suction in the cup with her as I do with some of my other patients or my kids. You can release that valve or start over if you need to, if it's too tight or too much suction. And she's doing her own little dance line dance right there, maneuvers with her legs. All right, and then we're going to go 2 cups right in the middle at the base of the neck. And again, when you do the cups, it increases circulation to the tissue. It actually is going to help separate the tissue, layers of tissue. And as they stay there, sometimes they'll bruise and sometimes there'll be no bruising. All right, so we're back. Judy's had the cups on for about 4 or 5 minutes, and so we're going to release them now. Like I've mentioned on my other videos, you can pull a plunger and release. Sometimes I'll just kind of pull the tissue next to the cup, and it'll actually release the cup. And so we just want to release it with as much comfort to the patient as possible. With Judy, she didn't have any bruising, but when I go back in here, does that feel any different to you, Judy?
A little less tight.
She says it feels less tight. Is it less tender?
Mm-hmm.
Yeah. So she's saying it feels less tender and less tight. I might move the cups around a little bit more to treat this and relieve the tension in her neck and shoulders a little bit more. Of course, I'm going to do some adjusting. I'm going to continue to nag her about her posture, she would say, and anything that we can do to get her posture corrected, because she spends a lot of time on her phone and at the computer, just like most of us, and so we want to make sure we're correcting that as well. So thanks for joining us, and we'll see you soon.